There are certain new advances which has come up in recently in treating these cervical cancer patients, because we want to reduce the side effects of these patients in the long term. So we have seen multiple times in our follow-up OPs where we see these patients who have been treated 10 years, 15 years back also still alive, doing very well, but they do have certain complications which are mainly sometimes bleeding per rectum, or sometimes bleeding in the urine, or sometimes some patients do have burning urine. So in this, if we see all these complications, we do feel like maybe we should have done better for these patients. With now the latest advances in the techniques of radiation oncology will be the adaptive therapies. In adaptive therapy, what we do is, although this is a technique mainly for the external beam radiation, we also use adaptive therapy for the brachytherapy also. So in external beam radiation, what we do is we do a daily CBCT, which is daily scan of the patient, and on the scan we do the contouring of all the critical normal structures and also the tumor. So as we see, like every day we see that there will be some amount of volume changes within the body, especially bladder, rectum, all these normal structures. So when we do editing of these organs, we have noticed that these patients will have less side effects compared to other techniques of radiation. So that is about adaptive therapy in CS cervix. Then the adaptive brachytherapy. So initially, like we used to have those 36 hours or 40 hours of continuous radiation on brachytherapy with the LDR type of machines and all. But now we have the state-of-art MR brachytherapy techniques, which is like a boon for all these cervical cancer patients. So what we do in this MR brachytherapy, hybrid interstitial brachytherapy, is like once the patient completes the external beam radiation, we take up these patients for a MRI, and then we see how much is the residual disease which is left out after treating these patients with those 25 fractions of external radiation.